Welcome to the Y Connect podcast. As the heartbeat of the community, the Y is a connector where people of all ages and walks of life come together to elevate their health, wellness, education, and essential life skills. Hear the stories of impact and join the authentic conversations where together we'll discover the journeys and pathways people take to connect through the Y. Now your hosts, Zarina, Robert, and Allison.
Hey, we're back with Y Connect. It's so good to see my friends. I haven't seen everyone. We missed you, Zarina, during our last recording.
Yes. It's great to be back. Happy to see you guys. How have we been?
It's a great morning. Great morning in the rain.
A rainy morning, but we've got someone on today's show that we're really excited that will bring just a lot of hope and, what in terms of how we're working together to support children. So, Robert, why don't we let you do the honors of introducing our guest?
Absolutely. And when we talk about championing child advocacy together, it comes together to supporting the needs of children and families throughout Metro Atlanta. The Y considers Children's Healthcare of Atlanta one of its most essential and strategic partners. And together we provide communities greater access to swim lessons, water safety, behavioral and mental health healthcare services. And the Y leans on Children's Healthcare of Atlanta to provide our staff the essential skills and training to support children. Joining us to share more about this partnership is Marc Welsh. Marc is the Chief Diversity Officer and Vice President of Child Advocacy at Children's Healthcare of Atlanta. In his role, Marc leads children's statewide community efforts focused on obesity prevention, behavioral and mental health, injury and illness prevention, and child protection. Marc is also responsible for children's employee and physician wellness programs, which promote health and wellness initiatives in the organization's 13,000 plus employees. In addition to his role as VP of Child Advocacy, Marc was named Children First Chief Diversity Officer in 2021. Marc also serves as the Board of Voices for Georgia's Children and Soccer in the Streets. Previously, Marc held leadership roles at Jackson Health Systems and Nicholas Children's Hospital in Miami, Florida. He received his undergraduate degree from the University of Miami in biology and religious study and his master's in public health from Florida International University. Welcome, Mr. Welsh.
Oh,
Thank you.
Welcome.
Thank you for having me. Anytime I hear someone read that, it reminds me how tired I am. See, work this happening, the amount of things that are going on, but I appreciate that warm intro and reminder of the work that's happening.
We're so glad you're here.
Thank you for having me.
So, Marc, I'll kick it off with the first question for you. How would you describe Children's Healthcare of Atlanta's advocacy strategy?
That's a great question. And so when we talk about child advocacy, we're really talking about all the work we do in the community to keep kids well. One of our physicians, I think, said this perfectly. There are a lot of things in the life of a child that we can't prevent, right? So we have kids in our hospital right now receiving treatment for cancer. And as much as we wish we could prevent those things, we don't yet know how to do it. But there are a ton of things that we can prevent. And our child advocacy strategy really centers around preventing those things from happening to kids. And so for us, it's vitally important that we give the energy and resource behind working in the community to impact the lives of kids, keep them healthy, ensure that we are protecting childhood. And that's what we think about when we think about child advocacy at Children's.
I'd love to drill down a little bit. Specifically, Children's is known for their Strong for Life campaign. Would love to hear more about what that campaign is all about and the goals of Strong for Life.
So great question. When we talk about child advocacy is the strategy name here at Children's, right? So that's what we call our strategy that's focused on this prevention work. Out in the community, it's known as Strong for Life. And Strong for Life was formed many, many years ago, focused on childhood obesity. So at the time, Georgia was number 2 in the nation for childhood obesity. And the organization said, we have to do something about it. And that's where Strong for Life was born. It was really born on this focus of saying, we can do more for our kids as it applied to childhood obesity. In 2019, that expanded to this much broader scope and the child advocacy strategy was born. So, Robert mentioned in my intro that now focuses on childhood obesity, injury and illness, child protection, and behavioral and mental health. So Strong for Life, our real goal is to help caregivers raise healthy, safe, resilient kids. That's what we're there to do. And so that really relies on us working with folks like the folks at the Y, folks who are working every single day with kids to make sure that those adults are equipped with the knowledge and resources to make an impact in the lives of those kids and the health outcomes for those kids. And so Strong for Life exists in that way. All in all, we are looking to really improve health outcomes for kids across our state and specifically here in Metro Atlanta.
Nice.
Thank you.
I can just add a little to that, add another question to that. Do you find that certain areas rely on those strategies a little bit more than others?
Absolutely. I think that there are some of these concerns that cut across all communities, every area of our state. So when you think about behavioral and mental health, for example, we are at a crisis point as a nation. And so no matter the community that you live in, no matter where you're coming from, families are getting impacted by concerns around their children's mental health. The drivers are different, though. And I think we need to always be clear on that. When we look at our under-resourced communities, they're very different drivers than what we see in some of our affluent communities around the state. And so there are certainly components of geography that come into play. When you think about childhood injury, we know that those are really focused in our Black and brown communities, right? And so we want to make sure that the efforts are also focused in those areas so that we can see those numbers shift. So certainly from community to community, there are unique challenges. And that's why when we look at this work, we also have to look at it through the lens of equity. And what equity would tell us is that each community has unique needs that need to be met. And so we need to consider that when we're building interventions, when we're thinking about how we engage those communities, the real unique needs of the communities we're trying to impact.
Excellent. Excellent. Marc, if you will, please explain to our listeners Children's Healthcare of Atlanta's Raising Resilience Initiative.
So Raising Resilience has been a labor of love for the team and something that has been core to our work in Strong for Life. And it really started out as a goal for us to hopefully destigmatize mental health amongst families across our community. So if you go back into this journey to what I like to call the before times, before the pandemic, you go back to 2019, our view of mental health as a community was very different. I think we've made great advancement in our ability and willingness to talk about this. But pre the pandemic, we didn't talk about it, and especially true in Black and brown communities. We didn't talk about mental health in the way that we do today. Raising Resilience was really framed as a way for us to begin a conversation with the community around the well-being of kids, the mental well-being of kids, to start this process of saying, okay, what do we do to support the kids in our lives? And that is about building this concept of resilience. Well, how do you do that? Well, you do that really with two core things. One is normalizing conversations around feelings and emotions. So it is okay to feel what you feel. Let's help children name that. Let's help them really be able to say, okay, this is what I'm feeling in this moment, because you have to be able to identify it in order to address it. So that's the first part. And then right alongside that is how do we proactively teach kids coping skills? Right. And so I always kind of use this analogy. I know this is true for me, maybe true for y'all. Y'all look like you're in better shape than me. But if I went to any one of you and said, hey, tomorrow we are going to run a marathon and we haven't done any training, you all would look at me like I have two heads.
Right.
But in many ways, that's what we're doing with our kids as it applies to their mental health. Right. We're saying go out there and face everything that the world is going to throw at you, but we are not going to prepare you. We are not going to train you to navigate that. And so the work of Raising Resilience is to say, for those of us who are adults, we have a role in preparing our kids, proactively teaching them coping skills so that they have those ready when they face inevitably what life is going to throw at them. So that has to happen in a proactive way. We don't train for a marathon when you're running the marathon. You got to train before you encounter those things. In the same way in life, we got to train kids to, be able to handle life's ups and downs when they're not experiencing the ups and downs, so that when those things inevitably happen in life, they are ready to tackle and navigate.
I'll never forget a conversation that we had with you, Marc, when you all were launching the Raising Resilience campaign, and it stuck with me. And it was, the job of a parent is not to make your child happy, or are you raising happy children? The job of a parent is to raise resilient children. So they have all of the skills needed to be able to navigate life's ups and downs. And that really stuck with me. Really
I appreciate you raising that, Alice, because I think it's so important, right? We kind of innately want our kids to be happy. And I think that pursuit of happiness is misplaced, because the reality is that we should want our kids to be resilient, to be able to experience all the emotions that life offers, because we're not always going to be happy. I woke up this morning, I wasn't all that happy this morning, and that was okay. But you got to navigate that. You have to be able to say, okay, that's okay. That emotion that I'm feeling right now is as important as happiness. How do I navigate that and get back to my place of equilibrium? And so really preparing our kids to navigate that is important. Within that, the other thing that I'll call out, and I always have to give credit to the work that you all do at the YMCA, core within that is, how do you establish these safe, stable, nurturing relationships in a child's life? We know that those are hugely important for a kid and the trajectory of a child's life. The child has just one of those, it completely changes their outlook in life. And in the absence of those being their caregivers, they look to others. They look to their coaches. They look to their teachers. They look to all of us as adults who are in their lives. So we all have that opportunity to play that role in a child's life. And I think you all at the Y do an amazing job of that. And I want to always reflect and applaud the power that you carry in a child's life and the ability to change their trajectory.
Thank you for that, Marc. That goes right into my question. So, resiliency training for YMCA staff and youth has been a critical component of building stronger communities. From your perspective, can you share how it helps support the well-being of children and families?
So, I think, all of what we just talked about leading up to this question, but I think, what we all know is, even for us as adults, and I would say to each one of you, I won't put you on the spot, but if you reflect on what you heard growing up around emotions, I would say that we probably heard some things today that we'd be like, oof, well, that doesn't feel right, or that doesn't sound right today. And so what the training and resources that we provide to the adults who are interacting with kids are focused on helping us to address some of what we learned growing up and how we really should be approaching kids today. So how do we better engage with the youth that we interact with each day? How do we support their emotional development in a positive way? And that's something we have to learn, right? Because I think I can speak for myself. As a dad, my instinct is to repeat the way that I was raised. And my parents did an amazing job. Mom and Dad, I love you. You've done amazing with the three kids. But there are things that they did when I'm growing up that I say, maybe that's not what I want to do. And so learning that approach has been important for me as an individual. I think it's important for any of us who interact with kids to be equipped with the knowledge of how do we best support the youth in our lives. So for those of you who are positioned in youth serving organizations, you live that every single day. And so we want to make sure that we're equipping you with the tools, knowledge, resources to be able to say, I know how to engage that kid. I know how to engage that caregiver, and to best put them on a path of what we all want, which is well-being, growth, development, to where they grow into healthy, resilient adults. And so really equipping teams with that has a huge impact on the lives of kids.
We have been so grateful that the last couple of summers, specifically, your team members have come over and worked with our youth development staff leading up to summer camp, because that is our Super Bowl at the Y. We open our doors to working families across Metro Atlanta so children have a safe and fun place to go every summer. But with that responsibility, we really needed those skills. We didn't come with them naturally. So I also want to lift up this, if you can see, this flyer that actually I found in our break room that you guys provided, and it's for our staff, and it really gives parents some helpful tips on how to have conversations with your child. How to ask an open-ended question, how to actively listen, and how to validate your child's feelings. So thank you for the tools in the everyday in our break room. I love that.
Well, thank you for putting them out there so the folks can access it. I'm grateful. I'll be honest with you. I turn to those resources myself often. My little one is just about to be 7, and there's times driving home where I'm I'm like, all right, I got to ask these open-ended questions. Let me make sure that I'm engaging you in the right way here.
Instead of how was your day? Fine.
Right. Get a little bit more.
Tell me about your day.
So there are certainly tools that are important in how we interact with our kids.
So any outcomes that maybe you all have tracked since launching Raising Resilience that you could share with us so we could tell our listeners so they could kind of see that work in action?
Yeah, absolutely. I think there's a few things that we've looked at and some things that we're looking at in the longer term that we don't yet have data on. So I think in the immediate, what we have seen is this kind of increase in knowledge and understanding around this concept of resilience. So as this first step, what we're seeing is that people understand these core building blocks of resilience and how you need to change your behavior, which is the first step, right? I want to know that I'm increasing your knowledge and that your intent to change the way you interact with kids is moving in that direction of change. And so we've seen that. We've seen that movement. What we're now mapping over time is to say, okay, looking at a number of national surveys that are also here in Georgia and where we're doing oversampling in Metro Atlanta, how is the actual resilience of kids in our city changing? Right? In the areas where we're working on these scales of resilience, what are we seeing happening in our community? And we're hoping to see that increase over time. So I'll be able to report out on some of that as we collect that data. But in the immediate, what we've seen is we've seen change in not only knowledge and understanding, but in many of the environments where we've worked and where we've gone into early cares and done observation, we have seen a change in the way that adults are interacting with kids. And so we know that meaningful change is happening. We're seeing change in the way that pediatricians engage in their visits with kids post the training around resilience, where they're asking questions around how do you feel? And they don't just mean how do you feel physically, but also how are your feelings? Where are you mentally? So we're seeing that change in behavior amongst the adults that we've trained. And hopefully over time, what we'll see is that translate in changes in outcomes for the kids that are getting impacted.
That's great. Thanks, Marc.
You know, Marc, you said something very interesting when you spoke of how we were raised. And you followed that with being intentional. At 53, I have daughters. I have two daughters. And at my age, now my conversations with a lot of the guys who I refer to as my day ones that I've known since. So, our conversations now have changed. It used to be from sports to what we're going to do that night, and to now it's, how's your kid? And it's interesting how many of us, although we have adopted some of the qualities and characteristics of how we were raised, that's our foundation, but it is intentional to, as you say, to show a difference of how we were raised to our children now. And it's not to in any way scare them from how we were raised, but it's to show them a different way of approaching a similar situation going through now. My kids being born in 98 and in 03, it's a lot different times than being born in 70.
Oh, yeah.
And so, the life was different.
Right.
And so just having a different approach, I honestly agree with what you say in terms of the difference that it makes in the long run.
Well, I appreciate you lifting that up and sharing your own experience. And I would say I have a similar experience. I'm an 80s baby, right? And the 80s were a very different time. And so, we recognize now, I think, talking to my friends and folks that now are in the same situation with young kids, you got to change the approach. To your point, ton of value in what we learned from our parents and from the elders in our lives, but also recognizing that we have to adapt for the time and realize how do we support this generation of kids. And a lot of that is with love and being able to wrap your arms around them and shower them with that in a way that, maybe we didn't traditionally do it in the same way. But it's needed. It's needed to really support their growth and development and make sure that they know every day, hey, you're loved and supported.
Absolutely. I'm going to jump back into the next question. Children's Healthcare of Atlanta has philanthropically supported the Y by providing grant funding to support the cost of swim lessons for families in Atlanta's under-resourced communities. Recently, these efforts have been amplified through the formation of the Atlanta Water Safety Coalition. Describe the coalition, its purpose, and some initiatives so far.
Yeah, so the water safety work that we have done with the Y is probably some of the work that I'm most proud of, because it honestly executes a model that I think is a model for healthcare on how you impact a community. And so I want to start a little bit with that Y partnership and then talk about how the Atlanta Water Safety Coalition has formed on the back end of that. When I think about the work we did with the Y, as a healthcare entity, we unfortunately see the back end of a drowning, right? That's the life that's being saved in our hospital, or unfortunately, sometimes a life that cannot be saved. And so we experience that back end. When you think about drownings as one of the top killers of children, we know that, hey, no pun intended, you got to go upstream to impact that. All right. And so for us, it was core that we're well positioned to get a message out to the community. And that message is around the importance of supervision, the importance of keeping a child within arm's reach or eyes reach and doing all you can to supervise a child. But we do not have pools at Children's Healthcare of Atlanta. That is not something we do. And hopefully, in most cases, we will not see a child every single day in the way that our partners at the Y do. And so you all have an amazing aquatics program, an amazing opportunity to access the community. So it made all the sense in the world to invest in the work that you all are doing in the community to make sure that kids receive swim lessons. So that's where that partnership and synergy comes into play. The ability to access and tell the story of prevention to the families, but also to make sure that kids who otherwise would not have access to these resources are given that bridge to resources. And that wasn't enough, right? We wanted to put layers of protection. So also making sure that more adults learn CPR. Because in the event of a drowning, we want to know that there's someone there who can respond. So how do we also make sure that we're training adults on CPR? And in some cases, also recognizing the economic benefit of preparing adults with another skill that they can use in their careers. And so thinking about all those components is where the partnership is so important. So then you move to the Atlanta Water Safety Coalition, right? We're doing this work as partners between us and the Y, and your all CEO, Lauren being who she is always looking for those connections and thinking about how do we build this out more, move this work to say, hey, there's an opportunity for us to create a stronger coalition of folks working together. And so through her conversations with Commissioner Cutler at Atlanta Parks and Rec was able to say, okay, what do we do here to bring folks together around water safety? And through those conversations, the coalition has been born, and Children's is excited and proud to be one of the founding members, along with the Y, along with Atlanta Parks and Rec, WABE, and the Red Cross. So all of us coming together and saying, hey, we're all doing this work. How do we work together to protect the kids in our city? And really, I think most of that work falls into 4 buckets, right? First and foremost is how do we raise awareness? How do we make sure that folks know how many kids and families are impacted by drownings? How do we help equip them with the knowledge of how to do better around protecting their child? Second is increasing the knowledge of swimmers. So how do we ensure that kids not only learn how to swim, but learn how to be safe around the water? Then there's another layer of protection. We know that we don't have enough lifeguards. So how do we promote the importance of training lifeguards, but also that this is an avenue for young people to begin to earn money, to get a skill set that is going to be vital for them throughout their lives. And so how do we build this pipeline of lifeguards? And last, how do we create these other layers of protection? So the importance of ensuring that folks in our community are trained in CPR and can respond in these instances. So the coalition is really meant to bring folks together who are interested in doing this work. And the first 2 events that we've held, for the world's largest swim lesson, using that as a platform to tell this story. And then most recently, with the screening of a film, Drowning in Silence, that I have to give credit to Allison for doing so much to pull that together, but an opportunity for us to also say, hey, let's talk about this. This is happening right here in our neighborhoods. Let's have a dialogue. Let's make sure that we're doing more. Because again, there's a lot that we can't prevent that's impacting kids. These are things we can prevent. And so we need to make sure that we're doing all we can. And I think the coalition will help in driving that.
I appreciate
and I must say thank you. I must say thank you because the Andrew and Walter YMCA is one of those areas in Atlanta that has been under-resourced, one of those communities that has been under-resourced. And we have absolutely benefited from the contributions that you have made that Children Have Healthcare and the rest of the coalition have made in order to provide safety around water, swim lessons, adult swim lessons. So thank you. Thank you very much for that.
No, I appreciate that. And I thank you all for your commitment to making sure that we're impacting kids. And I also, I want to give a special thank you to the Givens family. And so this is a family who unfortunately lost their child to drowning, and they made a commitment that they didn't want any other family to experience that. And they've had a long relationship with Children's Healthcare of Atlanta, and they were key in us starting this program. And so I think, again, there's a model for us as a healthcare organization to say, how do we invest in the community in a way that drives our core goals, which is we don't want kids to have to need our service. We want kids to be healthy, to be kids, to enjoy their lives, for families to stay intact. And this is one of the ways that we do it.
Okay. All right. So let's discuss early learning a little bit. So the Early Learning Nurse Navigation Program is another initiative that Children's Healthcare of Atlanta supports, and specifically in the area of need throughout Metro Atlanta. Can you elaborate on how this program operates and the role of the YMCA and how it plays in supporting it?
So, we have all these programs, and I think programs are like kids. You're not supposed to have a favorite. Nurse navigation, though, is probably one of my favorite programs. And I started my career in a program very similar that was focused on in South Florida, that was focused on how do we help folks navigate this healthcare system and make a better connection for them. And nurse navigation is doing a similar thing. And so we have a couple nurse navigators in the community, one based in the Y and on the West Side. And we are very, very proud of Sharika and the work that she does in partnership with our friends at the YMCA. And I would say that they focus on three core things. I think first and foremost is being this bridge to the healthcare system, right? So really helping families understand and establish a medical home, understand how do you navigate this system to ensure that your children are receiving the care that they need, and then also focused in on these health-related social needs. So partnering with others, the Y has a wonderful infrastructure around this, but to make sure that the social needs of families are being met, because we understand very clearly how those are tied to health outcomes for kids. And so making sure that those are met and that those connections are being made. The second core part of that is for a subset of kids who have chronic disease. So think about kids who have asthma, diabetes, et cetera, that where those families need additional support, right? So how do we make sure that not only that this kid is getting to the right appointments and the services are there, but also that the family has the resources needed to understand how do I care for my child? Our goal is that once that child leaves early care and moves on to the next phase of their life's journey, that the family is equipped with the tools and resources needed to ensure that the care of that child continues seamlessly. And then that third bucket is really health education, right? Our nurse navigators act as health educators. They are there to help educate families around general health and wellness of their children. And so to have that resource available in an early care center of someone who has that background and can speak off, with knowledge, with a knowledge base that is impactful around, hey, here are the things you need to understand around your child's health is core to what the nurse navigator does. I'm going to throw in a bonus one. And the bonus thing that the nurse navigator does that I think is most important is that they become a true resource in the communities in which they sit. And so where there is longevity with a nurse navigator, long after a child has graduated from early care, that family still knows that there is a resource there that they can call, that they can reach out to help bridge the needs of their child. And that's important, especially in our under-resourced communities, especially in our Black and Brown communities, where there is often anxiety around the relationship with healthcare, right? And so having someone that you know and trust that can act as that bridge is vitally important. I'm a strong believer that early changes everything. And so what we can do early in a child's life sets them on a completely different path and trajectory. And so focusing in on early learning is that core place where we say, not only are we going to wrap our arms around this child with love and guidance and all the things we've talked about, but also we're going to make sure that these families have the knowledge and resources of how to navigate the health journey of their kids. It's vitally important to the success of this child over their lifetime. And so I think nurse navigators are an amazing resource, a wonderful bridge, and we are proud to have one based in the Y.
Yeah. And I want to thank you guys for that. Ms. Hillman does an awesome job here at EA, where she's building relationships with our families and our teachers. And she provides a lot of professional development for our teachers here as well. So we love it.
Thank you for that.
Mm-hmm. What we're hearing here is our theme, and that is that Children's doesn't just sit and say, we're going to wait here in our hospital and wait for children to get sick to come in, and we're going to take care of you. There is so much work being done, and that is the work you're leading, Marc, around how can we be advocates of families and be more prevention specialists and be out in our communities. You're taking Children's into communities, and that is just so rewarding. And it's really the key to this healthcare crisis that we have in the world. So thank you.
No, I appreciate that. Absolutely. Most healthcare does not happen within a healthcare setting. And so we understand that. We understand that the work happens upstream. And so we got to be out in the community. That's where the kids are. I mean, that's where families are. And so it's important that we bridge that gap, and you all play an important role in allowing us to do that.
And you've shared some of the success stories and examples. Is there any perhaps testimonial that you might share that really kind of highlights kind of the numerous ways that we work together? Anything that we might have missed?
You know, this one is one that I think about a lot, and there are tons of stories, I think, of individual impact on families, on kids that I could pull from. But one that stood out to me, and I want to go back to the water safety work because I think it's about how work multiplies, is, part of this campaign that we did was one of the things we wanted to hit on was this concept of it never being too late to learn. And I want to hit on why that's so important, especially in Black and brown communities, that there is this kind of generational barrier to learning to swim. A lot of kids don't learn to swim because their parents didn't know how to swim. And the parents didn't learn how to swim because the grandparents didn't learn how to swim. And some of that is based, quite frankly, in the racial challenges that we've had as a nation and a lack of access. And so I want to acknowledge and call that out, that there's a unique impact on Black and brown communities as it comes to learning how to swim and being able to take part, not only safely, but in the joy of being able to be in the water and take advantage of that. So as we engaged in how do we tell the story, we were fortunate enough to have Ito Smith, who at the time was an Atlanta Falcons running back, put his hand up and say, I don't know how to swim. I'd love to learn. And I want to pause there, right? Here is a young man, he was about in his mid-20s at the time, had never learned how to swim. Talked about how that had been a limiter in his life. And even into his adulthood, when everyone else is going on vacation, enjoying themselves, it was a limiter for him. And think about that there are many more Ito Smiths out there who would never had an opportunity to learn how to swim. And for him to put his hand up and say, yep, I want to learn, but not only do I want to learn, I want to use my journey in learning as an opportunity to tell others it's never too late. And so I think about the individual impact on Ito and him going to classes at the Y and swimming alongside kids and learning and being very open in that experience of the impact that it had on him, the impact that it would have had on those kids that were in the classes with him saying, look at this, professional football player coming out here learning how to swim. But thereafter, after we shared his story, there were a few notable folks, I won't share their names, who put their hands up and said, I don't know how to swim. I'd love to learn how to swim. That is the multiplier effect of our work, right? And I'll go one step further. I think the experience with Ito, in many ways, was a reminder to us of the need to think about our swim programs as a multi-generational intervention. And so, as we've moved into thinking about, well, what do family swim programs look like? How do we extend swim vouchers that not only impact the child, but also allows the caregiver to learn how to swim? Because we know where there may be anxiety around putting a child in the water, maybe based on my own anxiety as an adult. So how do we make sure that we're bridging that gap and hopefully in that way changing the trajectory of community as it applies to being able to be safe around the water, but more importantly, to gain the benefits of being able to enjoy a summer day at the pool. And so thinking about how we are making that impact. So I'd like to think about the amplifying effect of somebody putting their hand up to tell the story and how that then impacts countless folks.
We're going to have a family on our podcast soon that is doing just that, a multi-generational swim lesson that's been taking place at one of our Ys. So, little spoiler alert, that's coming up.
Amazing.
Marc, I will tell you, you've definitely given me some nuggets. I think you just gave me my new mantra of early starts everything, or helps everything. I'm sorry, early helps everything.
Right.
It's never too late. I promise, I might get that as a shirt. I might put that on the shirt. I'll send it to you. I promise I'll send it to you.
Oh, yeah, make sure you get me one. I need one myself. Thank you.
That's awesome. I love it.
As we wrap up each episode of Y Connect, we like to end our conversation by asking our guest their pathway to the Y, their Y story. So in your own words, how did you first get connected to the Y?
I appreciate that question. So for me, I'm going to go backwards. I'm saying as a professional, I've spent my whole career focused on public health and programs that impact the lives of kids. And at every stage, the YMCA has been a core partner. No matter the city where I've worked, no matter the area where I've worked, the Y has always been there. And because of the core role that the YMCA plays in the lives of kids. So I think back to my own life. And as a kid, my family moved around quite a bit. And there was a period of our childhood when I was between 5 and 10, we landed in California. And in California, I remember playing basketball at the Y. And it was a very important entry point for me of having a place where you could go and enjoy all of what it meant to be in a safe space with folks who are engaged and care about you. And so I think about that now as a professional, and I say, oh, wow, look at how that continues. How this is an entry point for kids to be able to experience life in a different way. And so for me, my commitment now as an adult and as a professional is to say, how do we continue to not only celebrate that space, but also make sure that we're doing more to build up and lift up this resource that is vital to our community. So thank you all for what you do every single day.
Thank you for that commercial for the Y. We love that.
Yes.
That was awesome. Yes. Marc, this has been an absolute delight. Yes. Thank you so much. You taught me more than I knew before, and you've given us a lot to think about. And I just really appreciate our partnership. So thank you.
Well, I appreciate you all taking the time and creating a space for me to share what we're doing here. And more importantly, the partnership every single day, the impact on kids' lives every single day. And I hope you all take that to heart, that you're changing the trajectory of kids' lives. And I think we should never take that for granted. So thank you all for what you do. And I hope that, we've been able to share some knowledge with folks.
Definitely.
Thank you.
Thank you for listening to the Y Podcast. To continue the conversation or to find your closest Y, please connect with us at ymcaatlanta.org and sign up for our newsletter, Healthy Together.